In your morning medical news, the Trump administration is now being sued over its new gender-affirming care rules. That comes after the president signed an executive order called Protecting Children from Chemical and Surgical Mutilation, which allows federal agencies to deny federal funding to any institution that provided gender-affirming medical care for people under age 19. The lawsuit was filed on behalf of a group of transgender adults and teens along with their families. And if you're telling your kids to put down their phones, you might want to check your own screen time first. A study finds that children are mimicking their parents' phone habits, leading to more mature content consumption. Kids whose parents are glued to screens are more likely to watch R-rated movies and play mature video games. While researchers admit phones are here to stay, they say setting family limits could help break the cycle. Lung cancer is the leading cause of cancer death, and while early detection can save lives, experts say many of those eligible for screening don't get it. Mandy Gaither explains who should be tested and talks to a lung cancer survivor about why she says a billboard saved her life.
For months, Denise Lee passed a billboard that caught her eye. It said, "Saved by the Scan," advocating for people to be screened for lung cancer.
I smoked for 40 years, and so I consider myself high risk.
Lee says she didn't know about low-dose CT scans, a simple x-ray that takes multiple pictures of the lungs with little radiation. It takes only a few minutes, and there's no pain. After advocating for herself at the doctor, she was screened.
My primary care physician called me, and she said, yeah, they found a spot. Actually a tumor.
It was cancer, but Lee says because of the screening, the disease was caught early before it spread.
I always say that the billboard saved my life because literally that's what happened.
The American Lung Association says low-dose CT scans can reduce the lung cancer death rate by up to 20%, but only about 16% of those eligible for it in 2022 actually got tested. Anyone between the ages of 50 and 80 who smokes now or has quit within the past 15 years and has a 20-pack year or more smoking history should be screened.
You multiply the number of packs per year by the number of years you smoke. So 1 pack per day times 20 years is 20-pack years.
Dr. Bobby Mahajan says in recent years, the 5-year lung cancer survival rate has improved, but the earlier the disease is detected, the chances of survival significantly increase.
Lung cancer screening is effective and it can save lives.
And if you are interested in seeing if you qualify for that low-dose CT scan, you can take a quiz by visiting the American Lung Cancer Association's website. You see that on your screen here, savedbythescan.org.